Hello, everyone. Thank you for joining us. My name is Edie Stringfellow. I'm a Director of Diversity and Inclusion with the Massachusetts Biotechnology Council. Today, for Makeshift Happen, we're going to discuss anything and everything related to equity, diversity, inclusion, and engagement. For the month of October, Makeshift Happen is powered by Ironwood Therapeutics. I cannot thank them enough, not just for their support, not just for their commitment to ED&I, but everything that they are doing to improve and extend the quality of life for those with gastrointestinal diseases. Before we get started, I would like to go over the ground rules with you. For the first 20 minutes or so, it will be a Q&A portion between me and the guest. We mute everyone's audio and video during this time, but please do not hesitate to raise your hand if you have a question or to make a comment. We want the programming to be as interactive as possible. And for the following 20 minutes or so, we will open up the audio and video to the audience where everyone can ask questions or enter them in the chat section. The program ends at around 2:40 with a hard stop at 2:45 p.m. Eastern Standard Time. Now let's get started. Our featured guest today is a surgeon, an educator, advocate, a healthcare futurist, and an immigrant originally from Caracas, Venezuela. Through his career, he has focused on tapping the power of technology to coexist better, more humane with medical care. As a healthcare futurist, being a full-time practicing surgeon gives him the rare skills and qualities and advantages that clinicians have, but most technology innovators lack. That duality of expertise makes him the voice that definitely should be heard. A voice that impacts and addresses both ends of the spectrum, diversifying the target audience, feeding multiple interests and curiosities. Please join me in welcoming Dr. Rafael Grossmann. Welcome, Dr. Grossmann. And if you wouldn't mind, please introduce yourself, tell us about yourself, your background, your journey from Caracas to being the world's first surgeon to perform live surgery with Google Glass, and also what that means to medicine.
Thank you, Eddie, very much, and MassBio for the invitation. It's a great pleasure to be with you, and really a great opportunity to share a little bit of my background, my insights, and my educational message, I think, for everyone, and especially, the immigrant community, especially the Latin American community. So thank you very much. As you said, I'm originally from Caracas, Venezuela. I am a native, you could say. My family has been there for a few generations. The name is German, as you can tell probably, but we've been there since the 1800s. And I did med school in Venezuela, then was in Chicago for a year after I did 2 years of rural service, which is sort of the social price that we have to pay for getting free med school for 7 years. And
all right.
Then, after that, I was, like I said, in Chicago doing research, and then I went to do my surgery training in Ann Arbor, Michigan for 7 years. And then after that, we went back home, my wife and I, and 3 kids. And unfortunately, the situation at home was very difficult. And for a number of years, we were there. And then we decided to come back to the States and come back to New England, and chose Maine. And we've been in Maine for almost 16 years now. So what I do is general surgery. That's my full-time job. I'm a general and trauma surgeon, but 2/3 of what I do is a trauma and emergency surgery, critical care surgery, and the other third is elective surgery. So I used technology, as you can imagine, to do things that just a number of years, a couple decades or less ago, were not possible. Minimally invasive surgery, robotic surgery. So I'm a little bit of a geek surgeon. That's my full-time job, but in parallel to that, my outer life is trying to become sort of an influencer or an evangelist of how the smart use of technology can really improve how we do, how we learn, and how we teach healthcare, and how do we improve and enhance access to global health throughout the world.
Well, you talk about being a geek surgeon, an influence, and an evangelist. Let's talk about, I saw some of your programming before. Let's dive a little bit into the convergence of artificial intelligence and biotech, and where you said it's going to revolutionize the entire healthcare system. Walk us through this vision of yours.
Well, it's really it's a vision that I have that is shared by many people. And as you know, technology has been rising exponentially, since the beginning of time. And we've seen in the very last few decades how technology has really taken a sort of a sharp exponential curve in a way, and meaning that it's not linear, it's exponential. It's every if you think about the famous Moore's law, where every 2 years the number of chips in a transistor basically duplicate. That's been going faster and faster every time, not even related to transistors anymore, but to chips and beyond. So we have seen how technology has evolved in a way that we could not even imagine just a few years ago. When I trained in surgery, I barely had any interaction with laparoscopic surgery, minimally invasive surgery, for example, to say something, which is now the standard of care. Only 20 some years ago, robotic surgery didn't exist. Artificial intelligent algorithms, models were out there, but very basic, right? And now we're to a point when we have really a big push for example, artificial intelligent algorithms to help us do our job better. Not just the job of deciding which diagnosis or which drug you're going to give, but the job of which populations are being underserved, which populations need to be in the focus of a particular research. Are you missing a particular a group or a culture in regards to your design, in regards to your inclusion in healthcare and education. So anything really is possible. And I think that today we're at the point where technology is you can equate technology with magic. Thinking of the famous quote by Clark saying that any technology is advanced enough, it's indistinguishable from magic. Well, we are at that point right now. We're almost have the ability to almost teleport ourselves, like in Star Trek, to another location by doing virtual reality meetings and that sort of things. We are there, and it's just a matter of using that technology in a smart way for the benefit of humanity.
Now, you say using the technology in a smart way, and I also see that you are a strong advocate for disrupting medical education when all this starts. How should we go about doing so?
Well, I think it's about just thinking differently and the old cliche of thinking outside of the box. I really think we need to jump outside of the box, really more than that, because right now the box is so tight and so tiny that we need to really be visionaries of the potential of the technologies that were created today for entertainment, for play, for taking pictures of your breakfast. All those technologies put to a smart use could really potentially save lives. Years ago when the iPhone 4 came out, for example, in Maine, where I am, which is sort of a rural area, right, underserved area, we were trying to beef up the telehealth program, trying to reach out to local clinics or hospitals outside or inside our network. The area we cover is 2/3 of the state of Maine. So imagine that's an area larger than Massachusetts, New Hampshire, Vermont altogether. And so to travel, and many times during the season of, in the winter is impossible. So we had to find a way to connect and bring our expertise or get expertise from places using the technology that we had available. And when the iPhone 4 came out with a FaceTime, that was sort of an aha moment, for me particularly. I thought, well, why don't we use FaceTime to connect with these doctors rather than these $100,000 computers, that fail in the middle of the night. So if I can call my mom in Venezuela, 3,000 miles away, how come I cannot call the doctor 200 miles away just to potentially save someone's life? So we did an iPod touch-based program to do telehealth for acute trauma injuries, for example. And that caught the attention of the people here in Maine doing TEDx talks. And that was my first TEDx talk. And we called it iPod Teletrauma. And for me, it was a great experience because, being a surgeon, you're an educator and you're a communicator, right? But to be in front of the cameras and, online, to be able to influence and give a message to thousands of people, I really thought, this is really something that is not fun. only, it's a responsibility to be out there and to become a preacher of how technology can really be used differently in order to potentially improve access to global health, to save a life, to heal someone, to prevent disease. I think that the potential is only limited by our imagination and our heart, I think.
And when you say limited by our imagination, I want to just walk back a couple of steps, because I just can only imagine how fascinating it was to work with Google Glass. I was very fortunate to work on the very first filmed movie that used 100% Google Glass to make the film.
Nice.
I would like your insight, since we're talking about iPhone 4 and the iPads, what did it feel like to perform a live surgery using Google Glass, and how was it received by the patient and rest of your team?
Well, that's a great question. The Google Glass, for the ones who don't know it, maybe, it's just a little frame with a camera and basically the computer power is almost like a smartphone and a laptop in your forehead. And so when I was at a part of Singularity University called Exponential Medicine, and I did a sort of a course there, and I met one of the classes was the inventor of Google Glass. So when I saw what he was showing us, basically looking up anything online without us even knowing and telling us the answer, and so you were basically enhanced as a human being by the way of technology. So when I saw that and the potential of this, not just to connect to all human knowledge, via the internet, but to also take a picture or a video or stream live what you are seeing, I thought, wow, forget iPod, let's do Google Glass and use this as an instrument of to enhance connectivity and communication. I really passionately think that one of the, if not the main problems of healthcare today, as in many other disciplines, is the lack or poor connectivity and communication. You have all these means to communicate, and we end up saying nothing, right? And I think that a device like this could enhance us in that way. So I thought, why, rather than having, for example, my students be behind me trying to see what I was doing in the OR, or being on the other side and not touching anything because all sterile. So why do I just wear this device, right? And then I can basically stream in a safe and secure way what I am seeing. And instead of them being in the room, they can be drinking coffee in a conference room. And they can be connected to me, asking and answering questions also, pimping is allowed. And then show them my perspective of what I'm seeing live. And they can virtually be inside my head and virtually be in the surgery. So I thought that was pretty interesting. And so we did it, and we asked permission, from the patient and the family and the anesthesia team. And, it wasn't really a big deal to most people, including me. I did a little blog, and a friend of mine who writes for Forbes, John Nosta from Nosta Labs, who's a great friend and great influencer in healthcare.
Sure.
He wrote a piece, and it just became viral after a couple of hours, and the rest is history. The Google Glass back then was very much in vogue and kind of a sexy device. Everyone talking about it, and I thought, this is really a simple, intuitive use of technology to really improve how we connect and communicate without having to do anything or program anything. I just out of the box, so, why don't we use it this way rather than taking a picture of me, or someone in a concert or dancing or taking some, other simpler, less impactful experience.
Well, we can also look at that the other way. Like, with so much technology involved, do you think that has caused any type of relationship change between the physician as well as the patient? Do you think we've improved that human touch bedside manner through communication? Or do you think AI, virtuality has kind of put a burden on that relationship?
Yeah, I think technology is certainly as good as we make it, right? You could use technology to heal and save lives and educate. You could use technology to terrorize and harass and bully and kill people, right? So I really passionately think that way. I think that it's not about the technology, it's about the use of the technology. And in the case of healthcare and education, I think that if anything, you see how digital health, right, has been coined, that term, 15, 20 years ago almost, right? And we started, rightfully to transition from paper records to digital records. And that was important. And now documentation and data is easier to manage. And, there's a lot of benefits from that. But I think that maybe in a way the disadvantages have been more than the advantages, because I see that the newer generation of providers, physicians, nurses, and whatnot, PAs, physician assistants, have lost a great deal of humanity in the way they connect, or the way they learn to connect with patients. Back in the day, you would sit with a patient and hold their hand and, be there with them and look at the eye and maybe take a little note and just be a sort of a family doctor type of picture, no matter your specialty. That's luckily the way I was trained, and my father's a surgeon, so I have a very good example in that regard. But when you see technology kind of giving us a lot of requirements, so you go to see a doctor and immediately they say hello and they just turn away from you and they start taking notes in the computer and they don't even look at your face, So I think that is very, very much a problem. And we have created a generation in a way, it's to some degree of I call them cut and paste doctors, where the notes are all in the electronic medical record, not even thought of, but just cut and paste paragraphs, and mostly for billing and for compliance. And that is a problem. And I think that slowly we've been seeing that technology can really get us closer to the patient, make us more empathetic, almost paradoxically. And there's a few people who talk about this. If you think about doing a Google Glass interaction, there's a company out there that does virtual scribes using Google Glass. So when I'm with you in the office, then I'm with you, and the technology is there, and I can look up the EMR in the Google Glass screen, and I can maybe order a lab, or I can do, but also I could have a scribe, a human scribe. Eventually, it'll be an AI-enabled virtual avatar or entity or algorithm. But right now, this company uses a scribe in another country even, and that scribe is your scribe. And every time you are with the patient, the scribe is with you virtually with the patient, and the scribe gets to know you and know how do you like to populate the medical record, for example. And then at the end, so you don't have to really focus on taking notes or documented. Everything is being listened and seen by the scribe. The EMR is being populated, and at the end you basically go to the EMR, see your note, edit or not, sign, and go to the next patient. So maybe you don't get more time with a particular patient. Maybe the administration wants you to see 2 or 3 more patients in the amount of time, but you get better quality of time, because rather than me in the computer, I'm with you, empathetically connecting, looking at the eye, laughing, hugging, holding your hand, crying with you, giving you the news. There with you without having to distract myself by using the technology. So I really think that paradoxically, we have learned to be, or we are learning to be better, human, nice, humane care providers this way. We are suffering from something that I've seen coined the hashtag compassion fatigue. We're so fatigue about so many other things and technology and requirements to be, clicking and going through menus to comply and document, that we're forgetting the human being right in front of us. And that is a problem, I think.
Wow, so at this juncture, at this point, we're going to unmute everyone's audio and video. We'd love to see your smiling faces. I miss interacting with everyone, so I'd love to see you. We're going to unmute. Please raise your hand or send me messages through chat with your questions. And the interim, as you know, Dr. Grossmann, we are at the tail end of the National Hispanic Heritage Month. Would you mind, if it's not too personal, talking about what that means to you?
No, absolutely. I don't mind. I love getting personal. I think, I'm Hispanic, I'm Latino, I'm from Venezuela, Caracas, Venezuela, 100%. And still, that's the way we're at home. We live in the US. My wife is from Venezuela. My kids all speak perfect Spanish, Venezuelan Spanish, if that can be something. And we have Venezuelan culture at home. We eat arepas in Venezuela, and we eat arepas in Maine. So for me, it's really a matter of pride in that sense. And I love to talk about that and to make myself a resource, obviously not just for the Hispanic community, but I think that it's so important that we bring back, and the Hispanic community all over the world, but especially in the US, especially in this day and age, it's so important. And there's so much influence that we can have in how the country is run and how inclusive our society becomes. And I think that there's a lot to say about the potential that the Hispanic community has in order to contribute. And, people who come here, the majority are people seeking for a better life, and just like we did, exactly like we did, it may be a different level, but we are immigrants, so we came here because we couldn't make it in our country, and we wanted the best for our families. So it's the same way I came on a plane, but I could have come, by foot. And I think that we need to realize that that the Hispanic community, the Hispanic and other ethnic, nationalities, the community it's got so much to offer, especially in this country, in this melting pot of ours. That it's everyone is a guest in this country of ours, except the natives who were here before anyone else. That's the way I see it.
And thank you for sharing that personal story. We do have a question from an audience. Do you think the use of technology during COVID-19, like telehealth, would continue post-pandemic? And how does this impact the patients?
Well, I pray to God that it does, because I really think that, the way I see telehealth and telemedicine is just the way I see health or medicine. I don't think it's tele anything. I think it's a way to communicate and connect. I can send you an email or send you a fax or connect by Zoom, and it does not substitute what we should be doing when it's necessary. It's not a substitute for the physical visit when the physical visit is needed, but I think that is a way to, in a way, make the resources more efficient. We know that we have an imbalance of supply and demand for healthcare providers all over the world, but especially in the US. And I think that we have seen this pandemic as a force in a way to make us do what we should have been doing in a much better way decades ago. People say about the necessity being the mother of invention. I talk about the COVID-19 being the force or the desperation behind telehealth. And I hope the regulatory bodies, the federal government, the administrators of the healthcare systems, the local, regional, state entities have in a way relax, and relax is a bad word because it's not relaxed in a bad way. They made the regulations adequate to the times and to the technology. And you see how the FDA even have really, the FDA, CMS, all the entities have really come up to date in regards to using technology. And it makes no sense for someone 200 miles from me to come see me in the office for 15 minutes after having had surgery. It doesn't mean that I'm not going to ever meet that patient physically, but to have 2 or 3 visits before surgery for no reason other than to talk to the family members. So it is a way, again, it's about the smart use of the technology. I hope that the government, and I think that will be the way the government and the local state regulators and the administrators will not relax their, I don't think they will. It won't relax the way with telehealth, because again, it's not telehealth, it's health. It's got to be a pillar of any healthcare system. And I think that the way we're going to see it growing more, and it's becoming also economically feasible and a business for some entities, for some private people. And I think that insurance companies are seeing the benefit of it. And again, it's a way to allowing better access to global health. Global or at the national level, but even globally, So it's going to be great, I think.
Well, thank you. Next question will be coming from Dr. Jose Treveo. He is the CEO of SmartFam.
Good, Jose. Hi.
You unmute.
There you go.
I was actually.
You're back on mute.
Okay. I called in with my headphones, but then it got screwed up. How are you? I said, hola, Dr. Grossmann. I can nerd out with you all day. I've got 3 questions, but if others have it, I'll intersperse them. So I'll start off with a more basic one, less nerdy one. When Google Glass first came up, by the way, I know Singularity University really well. I was actually a mentor for it when I was at Genentech. and I also met the Google Glass inventor. When it first came out, I thought this is perfect for healthcare. You know, this is the biggest complaint from physicians, right? Either they spend time paying attention to the patient, and then they spend an hour later, you know, writing notes all night, and then, you know, they almost do double work, or they do their notes while they're talking to the patient, which is what most of us encounter, and they don't even barely look at the patient, and they're looking at their computer screen more. So I thought that Google Glass would be perfect for this, and the technology has been around maybe for 10 years or more, where like, why not have somebody in the background or have an automatic, you know, scribe going while you're talking with the patient, and then you can pull up information, and it should make everything more efficient. So what has been the barrier for this being more broadly, you know, accepted? Has it been like people hiding behind HIPAA or some other stuff? What do you think?
Well, I think that's part of it. You know, HIPAA and some of the regulations really created obstacles and hurdles that were really hard to overcome sometimes. But I think, you know, it's about education and change of culture. And this is why events like this and, you know, webinars and conferences, I do a lot of global keynotes and things, trying to bring that message out, because I think that people need to hear the message from the patient to the administrator and the regulator and the government, because once they see that this is inevitable, they'll engage, just like the COVID-19 forced us to engage with telehealth, for example. But you see companies like Augmetics, which are now in more than 20 hospitals, I think, in the US, with a virtual scribe with Google Glass. And you see companies like View6, you know, with the View6 solutions or Blade or whatnot. You see the advent of new technologies, not just you know, smart glasses, but all the way to VR or AR or XR. That is growing tremendously, and we are, I think, at a point of inflection right now where the technology is so good and it's so obviously intuitively simple and applicable to what we do to communicate and connect better, from education to diagnostic to treatment even and rehabilitation, that it's going to be unstoppable. So I don't know, I just think that we needed some time to get used to this. I still think that Google Glass, with its basic design, you know, it was a marvel of design. And there are a lot of projects out there in healthcare and beyond, but especially in healthcare, that are using still Google Glass as a medium, as a platform to connect and communicate better. Augmetics, I can't remember the name of a couple. There's very successful ones in the Boston area where they're using Google Glass to interact and make, for example, kids with in the autism spectrum to empathize better, and companies based at MIT and Harvard with Google Glass. So there's a lot of stuff that people, you know, it got a lot of bad press, and I think that scared some people. But I think that from Google Glass all the way to the latest, you know, Magic Leap or HoloLens, I think that the technology here is now, and people, in February, right before the pandemic hit, I did my last keynote was at the FDA with an event called a VR healthcare. Imagine the FDA in Washington, or near Washington, you know, in the general area there, at the FDA building, we had an event that, you know, hundreds of people connected physically and remotely. And I was talking, a physician, you know, talking about virtual reality at the FDA. When would you think that? I never dreamed of that, to tell you the truth, this soon. And it did happen. And they're engaged, and they're seeing how there's no way to stop technology. And it's really imperative that we use technology, again, to educate, to diagnose, to treat, and beyond. Companies are making their mark, and this is unstoppable, I think.
One comment on the FDA is actually, the FDA is a lot more open to technology than a lot of people think. I think a lot of people put words in the FDA's mouth and say, oh, the FDA won't accept that, when actually, when I've talked to some regulators, they're more open to technology than one would think. Obviously, all within, you know, keeping things safe for the patient, et cetera, and validating things. But yeah.
Correct. I agree.
We actually have about 5 to 7 minutes left in the program. So we're going to get to as many of the questions as quickly as possible. In an interim, Dr. Grossmann, if you would be so kind to enter into the chat section how someone can possibly reach you, if you're okay and open with someone reaching out to you directly. If you could put your contact information or your website there. And the question that's in the queue, the next one is, you talk about AR and VRX. For someone who does not have a medical background, can you talk a little bit more about what this means and also exponential medicine?
Well, exponential medicine as a terminology, you know, exponential medicine means technologies that are not linear, that grow exponentially, and that can help us do better medicine by the smart use of technology. I think that nowadays, you know, we're so in a way embedded with technology. You know, from the moment we open our eyes in the morning, we might have a tracker or two, or rings, or phones, or alarms, or Alexa, or, you know, most people, many people, more people than we think. So it's a matter of this technology integrating into what healthcare is. You know, from getting data from wearables to sending that data to your primary provider to make you better, healthier. I think that there are no limits again.
Okay, great. And in your opinion, why is it critical to get more Hispanic and Latinx students into the STEM pipeline?
I think it's imperative, very important, like any other group, but I think that Hispanics in particular, you know, it's been 25% of the population, I think, is of Hispanic origin, I believe. You know, STEM, I mean, if you don't do that, then you'll fall behind, not just at a national, but at a global level. So I think that there's so much potential out there, and it only will happen if you educate early on these next generations. I think that it's a responsibility for anyone who is in the STEM, you know, a field or STEM fields out there, Hispanic or not. You need to really engage and give your share to the next generations. Okay,
Great. Is there anything, Dr. Grossmann, you would like to say to the biopharma community? Your closing remarks, anything that we should know? What would you like to say to the biopharma industry directly?
Well, I want to thank you for listening and for being there. I think that, you know, we all have a responsibility. We deal with human lives and with health and disease, and it's so important that at all levels of this healthcare chain, you know, we all work towards making healthcare what it should be, which is a basic human right, right? And I'm not saying this because we are in elections, because I'm not running, but it is true. I think that healthcare is a human right, and we need to make it so. And the only way to really make honor to that statement is to work actively towards that. It's about inclusion, equality. It's about really improving the way healthcare is accessed globally, nationally, and globally. I think this is very important. We have the tools and we have the talents, and we need to really, really exploit those and actively participate. You know, it's very, very important. So that'd be my message. And I put my contact info there. I'm very active in Twitter and LinkedIn, basically those two, but I'd love to connect with you and answer more questions, and I'd love to go talk whatever you want me to talk.
I truly appreciate that. And Dr. Grossmann, I thank you for sharing your insight and expertise. I also want to thank everyone that took the time out to attend today and for your participation. And again, for those interested in learning more about Dr. Grossmann and reaching out to him, his contact information is in a chat section. So do not hesitate to reach out to him now. Click on it. Talk to him while we have him. As you can hear and see, he's very busy. So thank you for making the time. I would also like to thank Ironwood Pharmaceuticals for their support, and also let you know about upcoming events that you may be in interest of. If I don't see you sooner, I look forward to seeing you October 26th for the next Makeshift Happen, where we will focus on a devastating report of 865 women leaving the economy due to bearing the brunt of the workforce crisis related to childcare, as well as what this is doing during the pandemic and what does recovery look like, especially for us in the life sciences industry. And on November 10th, November is Military Awareness Month, and we celebrate those who have served and their families We have Life Sciences Veterans Action Network event on November 10th. Bob Coughlin is a keynote. November 11th, we have the United Negro College Fund, Historically Black Colleges and Universities, the first ever Massachusetts Life Sciences Virtual Summit. I look forward to seeing you there. And last but not least, we have the MassBio Patient Advocacy Summit on November 12th. And for all of our upcoming events, please visit us at massbio.org/events. Have a great afternoon, and I look forward to speaking with you again soon.
Thank you, Eddie, and thank you all. Okay, wear your mask, PPEs, and vote.
You got it. Thank you, Dr. Grossman. Thank you, everyone.
Bye-bye.
Bye.